I'm Pam Lowe.
Pam, if you'll tell her, it worked for me to go to Zoom and then in through the, that's what
and
worked.
yes, thank you. And that's what Sydney, I think, is sharing and emailing out. So you all might receive a duplicate email, but it looks like that's how folks are able to get in. We've never had that happen before, so I'm not quite sure what went on, but alas. So before we kind of kick things off and before I hand things over to Michael Bleich, again, I'm the Senior Director of Development here at the School of Nursing. We've been hosting these types of virtual events really almost for a year, ever since the pandemic started. And so again, we're hosting Michael Bleich today. He is the director of our Langston Center for Innovation and Quality and Safety. And so he's going to be sharing some updates with us today. And I would like to call attention to a couple of folks who are on our call today. First, we have our Dean, Jean Giddens. I saw you were able to get in successfully. If you want to give us a wave, or if you want to say a couple of comments to everybody.
Yeah, thanks, Pam. Just wanted to give a little historical context to our presentation today. And just briefly, but many of you don't know the fact that in June 2013, Nancy Langston and I had a handoff meeting, and part of that handoff meeting was a conversation with the leaders at VCU Health and their interest in establishing or honoring Nancy Langston for her years of service as the dean here at VCU by establishing a center for, at that time they wanted a Center for Quality Education and Innovation. And so we started this in July 2013. And we have, so 7.5 years later, it has been such an amazing process to see the Langston Center grow from a concept to a fledgling trying to find their way to what it is now. And I really have to give full credit to Michael Bleich for picking up the concept in a fledgling program and bringing life to it and bringing such good work to it. So you are in for a treat as you hear what Michael is working on and what the Langston Center has become. So kudos to Michael even before you start. But again, I'm glad you're all here, and I think you'll enjoy hearing what is going on at the Langston Center.
Thanks so much, Jean. And as we were kind of working through the technical difficulties here, you heard Michael and Nancy Langston having a conversation there. So Nancy, I see you're on as Nancy's iPad today. And so we're really pleased that you could join us. And so before we get started, just a couple of housekeeping items here. There are several really great questions that were submitted ahead of time. And as Michael goes through his talk, he may address and answer some of those questions. But if something crops up that you are interested in knowing more about, or a question just in general comes up, feel free to use the chat box or jot them down, as we'll be able to address those at the end of the presentation. And feel free just to use the chat box in general if you'd like to introduce yourself, share with us your affiliation to the school or why you're interested in the Langston Center. And if you could also please remain muted, that will just help us to have a seamless presentation today. And Sydney had shared her direct contact information, as some of you I think have already used today. So if you have any additional challenges, please feel free to connect with Sydney via her cell phone if you have any problems. And just a quick introduction of my team. Amber, if you can give a wave, if I'm not sure if you're on the top screen, but Amber is our Alumni Relations and Stewardship Specialist. She handles the planning of our major events, including our donor recognition event, as well as reunion. And Sydney, who you've heard from directly and who's working behind the scenes right now, she's our development specialist. She's been really managing all of these virtual events as well as donor acknowledgements, and she assists with event planning and the coordination of these events. So from here, I would like to hand things over to Dr. Michael Bleich. And as I said, feel free to use the chat box and ask questions there. And at the end of the call, then I'll go through the pre-addressed questions. So Michael, I'll hand it over to you.
All right, and I'd like to thank Sydney for helping organize me, and she's going to be the master of the AV today so that I don't have to stress over it. I confess fully that I recently had cataract surgery. My vision isn't so clear, so I'm glad for bold print today. So, you know, it was delightful to see so many people in the room. Some are faculty, some are students. My friends, the Firesteins are here. I see Sarah here, Charles Smith. There's so many people. And of course, Nancy. I'm always glad to have the opportunity to touch base with her. And I hope we didn't say anything too, if they were listening to us, Nancy, I hope we behaved ourselves in an appropriate way for the group. But
Me too.
Yes, if we'll just go to the next slide. You know, it was, you know, my coming to the school was to give the innovations lecture that the Firesteins sponsor. And I had the good fortune to know Jean a bit before, but never really had worked with her. And we started, you know, brainstorming after that presentation about doing some faculty development work. And so I was fortunate to come in and spend some time with faculty and staff with the Langston Center and with the Richmond Health and Wellness Program to do some consulting there. And so we were really going back over, you know, what was the core of the mission? What did we want to achieve? And so I won't tell you the entire story, but let me just say that at some point, I became the director of the program. And, you know, as a career-ending kind of experience, I would wish this for anyone because it has been delightful to go back and to be involved in teaching, to be involved in program development, and to work with a great set of leaders and faculty that I absolutely admire and are proud to call colleagues. Along the way, we did a little bit of refinement of the mission and vision. One of the things you'll know today is that it's the Langston Center for Innovation for Quality and Safety. And the whole focus has shifted to the fact that quality and safety and making that innovation link was really important. Innovation was kind of tucked at the end in the past. We also refined our mission, doing some work with Bill Bishop and some other people, you know, and today you have in front of you, you know, you can read what our mission and what our vision is. And we really are sticking with that. It has turned out to be that both the mission and the vision of what we're engaged in is really where we're gaining energy. We're gaining people's imagination. And I love that we were able to develop kind of a new, it's like a trademark. It's not a logo, but it's our trademark. And that's to envision the possible. And I really do believe that I like the people part of that. That's the little dots on the end. I like the energy that flows through. And I like the fact that we are able to do the work that we've done. If you turn to the next slide, you know, there are 4 functions of the center. And those 4 functions really hold true. We're trying to create models that bridge healthcare quality and safety. We really are committed to technology-driven innovation, but we're also trying to do this through the lens of social and moral imperatives. We want the human experience in healthcare to be the best. And so that function is really important to us. It's almost philosophical in some ways. The second function is to generate learning experiences. And today we're working with various professional schools, local and regional health systems beyond VCU, the at-large community, and we're working with policy influencers, and you'll see that in the presentation. Obviously, we want to support the missions of the School of Nursing, which are all of academic research and practice, and then we work closely with the development team that you just saw, and for those that have been able to support the Langston Center, we have tried to be outstanding stewards of those resources. So that takes us, I'm going to take each of these functions now and just very quickly highlight some of the things that I think have made a difference for the work that we're doing. So the next slide, please. One of the programs that, as a matter of fact, we meet this afternoon. So it's going to be a very intense Langston kind of day today. In the background here, you see 17 people that have been affiliated as scholars. I noticed that people like Dr. Smith or Terry Jones, rather, and I know we've got Charles Smith in the room too, but Terry Jones, and there are some others from this group. We have 17 current scholars that have affiliated with the center. And as of this afternoon, 5 will be inducted this year. And this is an interprofessional group. And I know that was always the original vision, but frankly, it focused very heavily on nursing only. And I think we're finding a kind of a sweet spot now. We have several physicians that are part of the scholars in the Langston Center. Obviously, have nurses and nurse faculty, people from staff development. We have a physical therapist who is an entrepreneur. We have a measurement specialist. We have innovators and entrepreneurs. And increasingly, we have a few that are from out of state. So it's no longer, we're being very selective, but we will have people. We have a physician from Brazil who's doing work in California and who's actually been to VCU and one of the most active participants. So this interprofessional group really has been advising the center. They've been helping market programs. And I'll share a little bit about our strategic plan for this year. Again, we're interagency now. So we really cover with Centera Health. We've worked with a couple of other nursing schools. And again, I mentioned our physician who lives in California, but he has created opportunities for us in Brazil. And so we're actually kind of getting a small group of people from Brazil who know of us and know our work and attend the programs that we sponsor. And again, within the university itself, we have had and enjoyed very good working relationships with the Da Vinci Center. And we're in process right now of signing an agreement with the Center for Public Policy at the Wilder School, because so much of what we do and how we want to have influence links to policy, and particularly within the state of Virginia. So very proud that Shelley Smith is part of that, and she works again between the School of Nursing and she does work with the Wilder School. But Robin Deal will also be one of our new affiliate scholars this year. And so I'm very excited about those partnerships, and I'd like to hope that in the next year that'll expand even further. Next slide, please. A lot of what we've done, from the beginning, it's always been done well. I'd like to think that we're trying to generate learning experiences in different ways. Obviously, the power of education cannot be understated. If people know something or what can explore something, those are great opportunities. So when we do programming, again, we've done this with the help of the Firesteins. We've done this with the annual quality program that we've done. This last year's quality forum, we redid it 4 times because of COVID. We rescheduled it 3 times face-to-face, believing the pandemic would end, and then ultimately did it virtually this fall. In all of those situations, there are 3 things that I use as guiding principles. 1, I like to push the boundaries of people. I like to make sure that what we're doing gets people to think, and to think about quality, innovation, safety in new and different ways. And I'll give you some examples of what's upcoming. I also really appreciate the opportunity to fill in gaps. So for instance, this last year, we worked with kind of the father of implementation science, a brilliant professor who worked with NIH and got really to the point where grants now have to have an implementation science piece in the grant. That is, science by itself is insufficient. It's got to be used by the public. So we were able to work with Dean Fixon, and I'll share that with Dean's work. All of those lectures are now captured and they're on our website. So anyone can go back and listen to them. Now we have our DNP students and people in the health system much more aware of how to do rapid uptake of interventions. So we're filling in some gaps. This summer, we're going to partner with the Wilder Center, and we're bringing hopefully someone in from Gallup, because we don't have a lot of work that's being done on survey research. And yet the patient and the consumer experience is everything. Perceptions matter. So how do we analyze the data we have? How do we look at health equity issues by stratifying data that already exists, but we'll look at it in new and different ways. So that's filling in some of the gaps that exist. And again, always with a future orientation, trying to make sure the school and the center and the work we do, we want to be on the cutting edge. So next slide, please. You know, it's been one of the things that one of the functions was to support the School of Nursing in its various missions. And so I've done that in different ways. Again, it's shifted around because of COVID, but one of the programs that is now under the auspice of the Langston Center, a program that, again, Dean Giddens and Dr. Barksdale launched, it's the Undergraduate Fellows Program, and we do mentor matching with that. That program runs, it's a year-long program. This last year, we had an unprecedented number, 62 people applied. And for the first time, we now have a leadership track and a research track. And I wish I could expose all of you to every one of the 11 that are in this program, because they are the best of the best. They are a diverse group. And in the situation of the leadership project for this year, for that track, we're dealing with the issues of health equity and immunization fear in underrepresented communities. So we're doing some good community-based work to promote safety, literally save lives. I'm now in a position where I think that the longer I'm there, the more I have the opportunity to work. I'm personally advising 6 DNP students and 2 PhD students in some way. During the COVID crisis, I was asked by the dean if I would help develop a course in holistic leadership, which again addresses the leadership piece of quality and safety. I've done lectures, and I do a lot of individual coaching with faculty and students. And again, that's a great delight for me to be able to have that opportunity. And Dr. Ingrid Aboff is finishing up on a fascinating project as a result of the Bresenoff and Firestein Innovations Grant. And Ingrid is going to, I've heard her work and update. She'll be presenting this afternoon to the affiliate scholars, and you would be amazed at, again, the scientific piece and how it's linking to the quality of life for people with Parkinson's. So, so that's a little bit about, you know, yes, we're working with the PhD program. Yes, we're working with the DNP program. We're involved in the undergraduate program. We've partnered with the Institute for Healthcare Improvement to bring some of those courses into the curriculum. All of our DNP students graduate with a certificate in health safety. And again, we've had some fascinating outcomes from the programming that we've done. Specific to COVID, there is one program that, again, we have audio videotaped, and it's on our website. And that was the session done by Jay Van Bavel, who was out of NYC. Van Bavel's work is fascinating because he is using brain science technologies to understand the human predisposition toward a particular, whether it's a political view or whether it's a social view. So he does social science work. He was featured on CBS, and I made the connection with some of his work, and we took on the issue of to mask or not to mask. Why is there this controversy? And how do we develop strategies to increase compliance with even just mask wearing and hand washing? So those are some of the, again, activities that have made the center, I think, relevant during the pandemic. I also worked with, again, Dr. Deal and Dr. Smith, and we published a manuscript early on about the influence about health policy and are dealing with the issues of internet access, which we know is a life and death opportunity these days. So I'm going to give you a quick, we're going to switch gears a little bit. I mentioned a little bit ago that I was able to help develop a course in holistic leadership. Quality has a lot to do with decision making, the kinds of decisions that you get made. And so one of the things that was fun to do, and again, I was able to do it with the help of Elizabeth Miles, who helped with this, but this is hopefully, I've used this, I have a partnership with the American Organization of Nurse Executives. They've renamed themselves now, they're the American Organization of Nurse Leaders. I have the opportunity to present to this group. There are three tiers. One is at the manager level, one at the director level, and one at the executive corporate level. And so I teach complexity science for them. And again, get the opportunity to present and represent the Langston Center. I also get the opportunity to help market our graduate programs, especially the program in nursing administration and organizational science. So this scenario is very brief, but I just thought it'd be fun for you to see the kinds of scenarios we're using. So this takes place, there is actually, everything about this scenario is actually based on science and evidence. And there really is going to be a Hurricane Elsa. We went 2 years out, and this scenario deals with High Tide Medical Center. And again, you can see it's 2 miles inland from the Atlantic Ocean. And I am just going to say that, we present the health system. I had 30 students from the innovations program, Da Vinci, for the first time. We had 4 innovation students getting their certificate in healthcare innovation in this course. And then we had a lot of graduate students. And so they were given this scenario through High Tide Health System. And we introduced them to the medical center. And this particular focus was on decision making. And it deals with life and death, to evacuate or not to evacuate. And so it gets them into making real world decisions. So I'm going to ask her if we'll go, and I'm going to give you just a scenario. It's very brief. And then I'm going to end my presentation and we'll go for questions. But let's play this. This is what the students had in their class and some of the AONL.
Hurricane Elsa is on a direct path to impact Bays Bridge and disrupt the services of High Tide Medical Center. Tracking up from Bermuda, the National Weather Service has issued warnings. Already having moved from a Category 3 to 4 storm on the Saffir-Simpson wind scale, with sustained winds from 130 to 156 miles per hour, the storm can hit as a Category 5, with attributes similar to Hurricane Irma, the second strongest Atlantic hurricane on record. A Category 5 hurricane means that people, livestock, and pets can be in danger from flying debris, even indoors. Frame homes will be destroyed. Commercial buildings are also at risk, especially those with wood roofs. Metal buildings may collapse. Windows in high-rises may be blown out. Power outages will rival those that happened in Puerto Rico several years ago, and long-term water shortages are likely. Even though Bays Bridge has a modern infrastructure, meteorologists are warning that this is a storm for the record books. While the Saffir-Simpson scale accounts for wind speed, it does not take other factors into account. The National Weather Service warns of 20-plus inches of rain, storm surge, tornadoes, and overall potential economic impact. Hurricane Elsa is expected to make landfall in the evening, 48 hours from now. The governor has ordered an evacuation. Above average ocean temperatures of 84 degrees Fahrenheit is sustaining the storm, which some say is exacerbated by global warming. Sea levels are rising and the jet stream is weakened, which causes storms to malinger slowly, wreaking more devastation.
Okay, so from here, students have to individually, they're given a scenario where they have to decide within hours what information, they have to work with the data that we provide them. They have to identify data that they will have or won't have available to them. They're given a scenario where there's certain ICU patients, there are certain patients, and then they have to consider the big picture of what else is going on around them, because in the health system, many of them think, oh, we'll just transfer everyone out, but you're transferring them out into a Cat 5 hurricane. So we get into decision making. What are the social risks? What are the clinical risks? And who do they want on their team? So this scenario, they start out individually, and then they take their individual decision into a group. And then they have to reconcile whether the individual decision, which may or may not have been the better decision, and we talk about consensus decision making and the impact on quality and safety and resource management. So this is just one little snippet to give you an idea of how we're building this in quality and safety into curriculum without necessarily it being a full course, but rather it's a way of thinking about how we deliver care. So with that, I'd like to end the presentation today. We'll pull up the last slide here. And that is to say that in terms of where we're going, I think the question was asked of me, what are you most proud of? Well, for sure, the fact that program attendance has gone up in every program we've done. Virtually, we actually had, I think it was 28 states and Brazil that participated in the quality forum this last year. We're working with organizations like AONL, CGFNS, and others. I love the idea that we've expanded our partnerships, that the people that are affiliate scholars, the people that are aligning with the center, the Da Vinci Center, the Center for Public Policy, and really I've enjoyed a wonderful, wonderful relationship with VCU Health. And I am so appreciative, of that. The opportunity to mentor faculty and students has been very fulfilling to me. And then I would have to say, and again, this is just my truth, is that working with the dean who is forward thinking and who supports the center, and with the development offices has been one of the reasons I've been sustained in doing this work. This afternoon, we're going to approve our strategic planning for the year. I'll share just a couple of initiatives with you. Again, we're going to work on survey development to capture and analyze the voice of the consumer. We're working with IHI to do a one-day seminar on the science of improvement. We're working on, again, our innovations lectures. But the other thing, and again, we want to continue to support our undergraduate fellows programs. And again, I mentioned what their program will be is dealing with immunization insecurities. The theme this year is going to be really driven around health equity. And this summer, working with, again, the Center for Health Policy and with our very own Dr. Smith, we're going to be hosting a colloquium on health equity and really deriving the interprofessional concept clarity with a policy-based action agenda. And then we'll be doing our own quality forum again that will deal with COVID and health equity. So those are just some of the things that are under discussion. And I hope this gives you just a quick overview of what we're doing through the center, and know that I'm more than happy now to turn it back and answer any questions that anyone might have, or any comments that people would like to make.
Sure. And, Dr. Bleich, thanks so much for giving us a glimpse into the center's work. And hopefully all of you who are on the call today were able to learn something new and pick up on some of the different activities that not only happen within the School of Nursing, but across the university as well, as you mentioned. So some of you may have some questions or comments that you're thinking of. We have a few pre-submitted questions, and I'd like to start with those. We've got time left in the hour. So Dr. Bleich, the first question is, how has the center led or participated in initiatives during this time of national crisis to support development of strategies to create environments for safety in physical and mental health of our healthcare workers in this time of unparalleled danger to them?
Yeah, that's a very interesting question. And again, we were going through our own crisis in managing COVID within the school, getting students taken care of, getting courses taken care of, and so on and so forth. I would say that the best response to that is that I have the good fortune of working with Dr. Deb Zimmerman through the American Organization of Nurse Leaders. And we are hosting, in December of last year, in real time, we did a point prevalence survey of national healthcare systems. Just finished analyzing that data. And again, Langston Center will be front and center, because we'll be hosting, I think it's 5 podcasts and 6 webinars. And we have dealt with PTSD specifically, and the long-term impact of chronic exposure to trauma that nurses have experienced. There is a hospital and health system that actually has a psychiatrist and a nurse practitioner that have made mental health rounds to implement strategies. So we're trying to pull out innovative practices, and we're trying to share that information on a national basis. Again, we wrote early on about some of the policy implications, and then we did work on trying to understand the human brain as it relates to why some people are more likely to put masks on and others not. So I can't say that we took, beyond developing courses and switching to our quality forum to a virtual format. I think all of us would like to have done more, but the reality was we covered our priorities in that way. But expect that this will be ongoing, because this is not yet over. And we know that we can expect other pandemics to be in the future. So I think our partnership with AONL, who is funded by Johnson & Johnson, will be an opportunity for the Langston Center to continue to have influence in every health system in the United States.
All right, Michael, thanks for sharing all of that information. Another question is, how can the public get involved with the Langston Center? And second to that, what is your outreach strategy for that, and anything that you can share in regards to measuring outcomes?
Well, that's a very interesting question, because I will tell you, our very own Angela Flagg has worked very hard to try to engage the public as we have. There is a perception within the university in general that what we're doing is not of public interest, and I could not disagree more. I think the public is very informed these days. And so a lot of our programming, they see the academic rationale for it and even the health system. So we get marketing in that way. But as we've tried to open up programs, the stretch to the public has not been well received. And so we've got some perceptions that have to be altered, and that's work that we need to do this next year. One of the things that we know that we can do is we can write more op-eds, and that we can use local media. And our partnership with the public policy group at Wilder Center has a much more defined mechanism to get that kind of information to the public. And so that's our strategy at this point in time, is to use and leverage that partnership and the fact that they seem to be given a higher priority to getting information to the public. Another reason why we're doing the work on surveying, because the Wilder Center also counts on public perception and public views on issues. I mean, I eventually would like to see, I know I probably share this with Dr. Smith, I would like to see a public policy emphasis on healthcare that is a shared experience that maybe the two centers would have together. But they do have a mechanism to do a better job. The other reality for us is that one of our affiliate scholars is a physician from Centera who is responsible for public communication. And so whether through our own mechanism or through theirs, I think this next year you're going to see us really trying to push the boundary of that in some new and different ways than we've been able to so far.
Michael, and also just for everybody else, Angela Flagg, she's our Director of Communications, who Michael referenced as he started answering that question. So the last pre-submitted question has to do with simulation. And that is, I see a great opportunity at the intersection of simulation and healthcare innovation, and would just really like to hear Dr. Bleich's thoughts on that topic.
I just shared with you a simulation. That's simulation. I think we always think you got to be in the room, you got to have a big dummy, you got to do all of that's true for certain kinds of knowledge, skills, and abilities. But what I just shared with you is a simulation. It is a simulated experience. It brings the students, and I've noticed that I've had several of students that were in the holistic leadership class who have commented in the chat box. And I will certainly take you out for lunch for all those positive comments, but they will tell you that using a simulation took it to a whole different place in terms of making it real. It wasn't just reading about something, it was actually kind of getting your whole psyche into it. And I will tell you that using Hurricane Elsa and the high tide health system and creating that, was a different way of engaging learning. It took them there, and then they had to really figure out what would they do, how would they do it, and then we created our own feedback mechanism for it. So I would say that simulations in quality can be done in very many different ways. So I'm a huge advocate of simulation in general, but I also want to push the simulation boundaries a bit to say it doesn't require necessarily going to a center, that there are many ways that we can involve and do simulation in other ways.
Well, Michael, thank you for your thoughts on that. And yes, I was going to call attention, but you already did so, to the couple of comments that have come through, and you mentioned that those were from students. So that's terrific. And Lisa, I see you've submitted a question as well. You said great work on investigating / challenging current mask theory. Will you also look at alternative COVID treatments?
Well, I think this is where the health system, in our partnership with the health system, is such an asset for us, because VCU health system has done more is on the cutting edge of research in terms of alternate treatments opportunities. One of our affiliate scholars is Dr. Allison Monpetit, who did a postdoc with VCU School of Nursing. And our partnership is strong, and it really is allowing us to stay on the cutting edge of what they're doing in terms of COVID treatment and interventions and evaluation. Our research team partners with them, and a number of us sit on programs where we're reviewing the kinds of things that are happening in the health system. So I couldn't be more proud of the work that they're doing, not only in terms of they've done, one of our affiliate scholars actually built a ventilator. That's Dr. Peter Pidco who's a physical therapist entrepreneur. I think he built a ventilator with like 5 parts that are accessible and low cost. They've done early work on proning and other, treatments that were implemented rapidly. And I know of at least 4 major studies that are going on over there that deal with vaccinations and testing and, again, alternate treatments. So this is where, again, when I talked earlier about the importance of the affiliate scholars, this is the pipeline that we have now that is maturing, I think, every year. And I'm hoping in a post-COVID world, or whatever that looks like, we will be able to, again, pick up our pace a bit. There's no question that COVID kind of threw us into a tailspin in terms of progress we were making. But I think we made the best of it, and I think we're moving out of that. And that partnership with VCU and Centera and other health systems. I have another one of my doctoral students is on this call who is with HCA. So we're expanding our partnerships and have access to helping organizations deal with issues that surround quality.
Michael, thanks for that. All right, that wraps up, I think, the questions that had been pre-submitted. So at this point, I'd like to open it up to anybody on the floor if you'd like to unmute yourself, ask any questions or make any comments. And as you're thinking about that, I was going to say Candace Johnson, she chimed into the chat, say greetings from Detroit and what she's starting to embark on as well, and maybe one day work with the Langston Center as an affiliate. So thanks for that, Candace.
Nice to see you, Candace. Thank you for being on today. I hope your transition to Detroit has been great. Thank you.
So again, feel free if you have any comments, questions, anything, feel free to unmute yourself.
I just want to give a shout out to my friends, Lisa and Steve. I see you both sharing a screen together there. They have been, everyone needs a little wind in their sails, and whenever I need that, they have become really, I would say, not only colleagues, but friends to me. And I am very grateful for all of the just boundary pushing opportunities that we've had together, and looking for more to come. So I'm glad to see some of you. I see Dr. Smith online, and so it's just nice to see so many faces here.
Yep, Michael, thank you for the update. I appreciate all the attention you drew to the working relationship that we've been developing between the Center for Policy and the Langston Center. Safety and public policy go hand in hand. And so it's been a really fun experience to conceptualize interprofessionalism to include more than just nursing, and work with our colleagues who really address the upstream factors of health, such as housing and urban planning and all of the things that sort of go into public policy. So it's been a really different approach to health policy, and I appreciate the opportunity to sort of serve as the bridge between the two centers.
Well, you've been a huge part of that, Shelley, and I just have to say that I share from the IOM work that I've done in the past on the future of the role of policy. Policy can drive change faster than anything, and the stroke of a pen. Funding can be changed, which sends people's resources in a whole different direction. So I think in nursing, we have sometimes underestimated the power of policy, and then you get state and federal. That policy is an important driver of what we do and how we do it, and whether we'll have the resources to do it. So good policy always starts from a good problem. So I'm very pleased with how that is developing. And with the Da Vinci Center, we're really pushing the innovations boundary. And I think the idea that technology is the catch-all. Technology, we need to build quality and safety into design thinking. We need to be aware of the impact as we're developing protocols. And the one thing about design thinking, it depends 80% on listening to the consumer's needs. And I think nurses are very good at doing things for patients, but not always with patients. And so I think we're learning that, and we're learning those acute skills in listening deeply to what will excite the consumer and is acceptable to the consumer. So those partnerships within the university are just priceless, frankly.
Thanks. Yeah, thanks, Shelley, for those comments. I see another question coming in from Kristen. Kristen, can you articulate any volunteer opportunities for alumni or future plans for alumni to contribute? And Kristen's 96th grad of our school.
Well, thank you for that. When anyone says volunteer, my ears always perk up. I think that's a conversation I'm going to put on the agenda this afternoon for our affiliate scholars. One of the things we're always trying to do is get people, selling programs in this day and age, whether it's virtual or face-to-face, certainly trying to get our work out and known. But also it seems to me like, our affiliate scholars, none of them are paid. These are all volunteers. And it seems like maybe we should be looking at how do we activate volunteers in a more active way. And that's a great idea for us to consider, and see if we couldn't have our own volunteer corps that might help us with certain activities.
Great, thank you very much.
Thank you. I also have to give a shout out here to Dr. Charles Smith, who is the Dean at Rappahannock. He was kind enough this week to invite me. I think I spoke to 150 of the student body and all of the faculty. And the topic was bridging leadership and quality. And so again, and I was able to, I think at the end, he permitted me to give a good plug to VCU for RN to BSN completion. And so Dr. Smith, hats off for that opportunity. These are the sorts of things that I always welcome and jump into the opportunity to do. And it's always a gift to be able to, again, use networking. He's also mentoring one of our undergraduate fellows. And so again, new partnerships, new relationships, building the network. That's kind of the essence of where we're at.
I
looks
want
like Charles.
if I could.
Oh, go ahead, Dana.
This is Dr. Dana Burns. I'm one of the faculty at VCU, and Michael Bleich has been one of the wonderful, empowering mentors for me here in my work. And we started at the Center for Healthy Hearts, which is a Richmond-based free clinic, and interprofessional rotation for our nursing students, from the bachelor's, master's, and even DNP rotate through. And we provide primary care to the vulnerable, underserved Richmond population. But what we've cultivated with this psychology, pharmacy, nursing, and medicine is this excellent interprofessional rotation, working with the Richmond population. So if anyone would love to volunteer when the rubber meets the road, we'd love help down here. But really focusing on new models on how to educate our our nursing and multidisciplinary approaches and providing the care.
And Dana is writing a concept paper right now that we've been working on together. And I'm very excited about it and its potential, because not only would it look at a student in a course, we would evaluate these students at several times throughout their trajectory to make sure that we're seeing growth and positive outcomes. So Dana is one, again, an innovator in education and in practice, and is the kind of person that I just enjoy working with so much. So stay tuned for that.
I know. One exciting thing is the Center for Healthy Hearts was just accepted as a clinical trial place for the Agency for Healthcare Research and Quality's new Team Steps Improving Diagnosis that will be released next year. So we're one of the trial sites to use this with our staff, but also educating our students as we go through. So really seeing those outcomes and using research-based, evidence-based practice to improve interprofessional care and quality in diagnosis. So we're excited.
Michael?
Oh, I think that is that you. Nancy, I think you unmuted your. Yep.
Yeah, just one comment. I'm really profoundly impressed with the leadership you and Dean Giddens have given to creating this expansive, truly a center that will have major impact, I think. To listen to what you've talked about, the connections you're making, the envisionment of future is just awe-inspiring, Michael. And Jean, thank you.
Well, Nancy, it started with you, and I want to personally thank you for your dedication to allowing innovation into this space. As always, you were forward thinking, and now the whole world is talking about innovation.
Right.
We had a jump start on it, and we continue to build that. So I want to thank you personally as well.
You're welcome. We really were committed to that, Michael. There was some push to have a center for safety. And I don't know how much you know about Lauren Goodlow, but Lauren was instrumental in the work of getting support for this center. But she was very committed to quality. And I was very committed to innovation, because I think that's what academics can do best with, is to create new models and look to new ways. We don't need to replicate the present. So it was a group process that came to that. We just had to put it at the end. So I'm glad that it was brought forward to be innovation in safety and quality. I thought that was a really innovative move, and I think it's just moved it light years ahead, and I'm so impressed. I have one comment about, as we venture into policy, and you were making the comment about we really are going to bring about the change in care through policy. One of the things that always fascinated me, and we didn't seem to have much traction, is as I looked at the environment, I think that VCU is the only comprehensive university with a comprehensive health sciences center in a state capital that is juxtaposed to the nation's capital. It seems to me like, talk about the opportunity for looking at policy and the relationship between state and national policy as it affects health and quality of care. It just sits there. Nobody else could do it.
We are sitting on a gold mine.
Yes,
and again,
yes.
One of the conversations I've had recently with Dean Giddens is, I think a legacy of this school in the future is really its alignment with policy and what happens in terms of you're right. We are blocks away from the state capitol. The work that Dr. Smith is starting to do and is ramping up to get health policy more recognized. The role of nursing in policy is being recognized nationally, but we are in the, we're in the Garden of Eden when it comes to opportunity. We're blessed
Right.
with the resources that are there. And, we talk about nurses sitting on boards and doing other things, that's all wonderful and it's true, but we can play a much stronger role in policy and get people experienced and practice and use our voice to influence change. Because trust me, when things are regulated, I hate to say that regulation is an incentive, but it is. And so there are many ways to address social policy. And again, I'm happy that the Langston Center is doing the partnership with the Center for Public Policy. Again, my dream would be to see that there is a Center for Public Policy in healthcare, that we can attract enough resources to make that a subspecialty in the Center for Public Policy. I don't have any say about that, but what I do have is if we can assemble the right resources and keep pushing it, it's kind of a field of dreams. If we start to build it from the bottom, I hope that it will come.
Thank you.
Thank you, Nancy.
Sure, and I did want to recognize we're a few minutes over. We did start a few minutes late, but I'd like to suggest that we conclude our program. But before we hang up, I just wanted to mention a couple of things. One is that Sydney will be sending out a post-event survey. This is for you to share your thoughts about this particular program, but also for you to share any thoughts that you have in terms of future programming as our team considers what would be of interest to not only our alumni, but other folks who were on the call today. So we appreciate any of your thoughts about that. And also, I think most of you were able to join in just a few minutes after we got through some more technical difficulties, but I think what I'd like to suggest too is that we recorded today's event, and we would be happy to send this recording out to all of you. So if you were able to start on time, or you were able to get online around 10 o'clock with us, great. But if it's a few minutes late, we'll go ahead and send the recording out to you just so you can pick up any parts that you might have missed.
And Pam,
so with that,
might you also add the website for the Langston Center on that?
Happy, yeah.
Because we've updated that, and I want you to know there are student projects that are now, there's an area for scholarship on that website. And so we're showcasing our own DNP students and other lectures. So if you want to, go around and see who are we, who are the affiliate scholars, where are they from? There's a lot of good newsy information on the Langston Center website. We used to have a separate website away from the school. It didn't get a lot of traction. So we now have it as a page under the School of Nursing, and we're seeing a lot more traffic. So if you would be kind enough to add that link, that would be even better for those people that want to, take a look and see what's going on.
Certainly. Happy to do that.
Thank you.
All right. Well, with that said, thanks so much, Dr. Bleich, for all of your, all that you did to put in today's presentation, and just for sharing some really terrific information with us. Really very much appreciated.
Thanks to everyone for being here.
You bet. All right. With that, we'll tune off, and thanks.
Bye now.
Bye.
Bye, Lisa. I see some of you. Goodbye.